Hi, everyone. Good evening. I'm Assemblymember Linda B. Rosenthal, and thank you for joining us tonight for our weekly COVID-19 town hall. I'm joined by State Senator Brad Hoylman for our 9th town hall, virtual, to discuss the newly discovered pediatric inflammatory syndrome infecting children that may be linked to COVID-19, as well as the physical and psychological health of children sheltering at home or wherever in this epidemic. Hospitals in at least 19 states report that there are these kinds of cases. The Department of Health is investigating at least 125 of them in New York State. And sadly, 3 children have passed away in New York City from the virus. In addition to this new mysterious illness afflicting children, kids have also experienced a dramatic shift in their lives that has disrupted the routines that help them to manage a world that is really built for adults. Many are experiencing great loss as they miss vital milestones. Some are struggling to stay focused while learning remotely. So we have a great panel as usual, and we've invited 2 special guests. Our first guest is Dr. Karen Wilson, Chief of General Pediatrics at Mount Sinai. And our other guest is Dr. Sanaa Bhatty, Medical Director of Child and Adolescent Psychiatry at Mount Sinai Morningside. Thank you both for being here. Brad?
Thank you.
Thanks, Linda, and welcome to our guests, Dr. Wilson and Dr. Bhatty, and our ASL interpreters, John and Andrea. You know, when we started these virtual town halls 2 months ago, there wasn't much information publicly known about COVID-19, and now that we're all used to social distancing and mask wearing and hand washing, moves very quickly. With some parts of New York State already reporting to be reopening soon, it's easy to think that the worst parts of the pandemic are over. But Governor Cuomo announced today there were 1,889 new COVID-19 cases. Yesterday, there were 2,419 new cases. And the day before, there were 2,762. So we're definitely trending in the right direction. Key indicators here in New York City, like hospital admissions and the percentage of people testing positive for the virus, are also going in the right direction. But the bad news continues. This past Thursday, the CDC alerted doctors to this new condition called multi-system inflammatory syndrome in children, or MISC for short. In New York, there are at least 115 cases, as Linda said. And it's scary for us as parents to think how vulnerable our kids can be, especially since we thought when the pandemic was first announced that our kids would be okay. That's why I'm glad we have experts with us tonight who can give us the best information available and talk about this and other important medical steps we can take to protect our children, including vaccines. Our first guest tonight is Dr. Karen Wilson. Dr. Wilson is the chief of the Division of General Pediatrics at the Icahn School of Medicine at Mount Sinai and at Mount Sinai Kravis Children's Hospital. She received her undergraduate degree from St. Lawrence University and her medical degree and a master's in public health from the University of Rochester. She studied an issue Assemblymember Rosenthal and I care deeply about: protecting kids from tobacco and secondhand smoke. And she's one of the few doctors in New York City who've treated this new COVID-19 mystery illness many parents are worried about. I'd like to invite you, Dr. Wilson, to share a few words to start off with.
Sure. Thank you, Senator Hoylman and Assemblymember Rosenthal. I really appreciate the opportunity to come and speak to the public today. Most of the time I'm stuck in my office on Zoom meetings, and so being able to, even if it's by Zoom, be able to get out into the community to talk about this new syndrome and about COVID in general in children. And as Senator Hoylman said, this is a very new syndrome that we're just starting to see. We had our first cases of it in late April. I first became aware of it very soon after that, and have had experience with treating these kids. And I think we're all concerned. There's a lot we don't know about this, but I do want to come and be somewhat reassuring that, for all the concern that we have, the kids that we've seen with this, for the most part, have done very well, and they're getting better. And I think that's the very, very important part. But I think this shows us very much that we need to continue to be cautious. We need to continue to protect our children, make sure they're washing their hands and they're wearing masks, to be able to reduce their risk of getting COVID before we have a vaccine and ways to prevent.
Thank you. Now I'm going to introduce Dr. Sanaa Bhatty. Dr. Bhatty is a psychiatrist specializing in children and adolescents. She is an assistant professor of psychiatry at Mount Sinai Medical School and is affiliated with New York Eye and Ear Infirmary of Mount Sinai, Mount Sinai Beth Israel, the other Mount Sinai's, and she is medical director of Child and Adolescent Psychiatry at Mount Sinai Morningside. Dr. Bhatty, please give us your thoughts.
Thank you. Thanks again for having me. I definitely second Dr. Wilson with it's really wonderful getting a chance to speak directly to people in the community and get out of our Zoom meetings and all of our day-to-day kind of new normal that we have. So, in this time, fear, uncertainty, anxiety are bound to be heightened for everyone, and kids are especially vulnerable, especially given they just have inherent, vulnerability, suggestibility. They don't have as much life experience, so they don't understand how things come and go. And just in general, depending on their developmental level too, it's really hard to make sense and decipher all these disruptions to their life, their routine, their normalcy. So, a lot of what we're seeing is entirely normal, and there's some strategies that we can mention later to help parents knowing how to support their children in these times. And then, there's some times where, they might need some additional help from a professional.
Thank you. Initially, we thought that COVID didn't affect children, and now it appears that it does. There are quite a number of children, 120 or so, who are afflicted with the illness that resembles some of the symptoms of toxic shock syndrome and Kawasaki disease. Dr. Wilson, could you describe the specific symptoms of the illness, and is the illness believed to be related to COVID-19?
So yes, this is definitely believed to be linked to COVID-19. And I think it's important to recognize that what we're dealing with is two different pieces. There's the initial infection with the COVID-19 virus that generally causes respiratory symptoms and all of the other symptoms that you've heard about in adults. So it can cause blood clotting problems. It can cause all sorts of weird things, but it definitely, for most people, has a predominantly respiratory presentation. And once again, predominantly in adults. And the few children that we did see with this were, for the most part, children either that were in the hospital for something else, like they happened to come in for a surgical procedure and had a test because they're going to surgery, and it turned out they were positive, so but they felt fine. Or kids who had some type of underlying immune disorder, or for instance, were on chemotherapy and were immunosuppressed. And then we started to see this cluster of cases that looked different. And what we started seeing were kids who were coming in with either something that looks like what we describe as Kawasaki disease, which is an inflammatory condition that we really don't know a lot about what happens, although we think it's provoked by a virus. And it shows up with rash and fever and red eyes and cracked lips. And we were seeing kids that were coming in with some of these symptoms, but they were also getting very sick and having hypotension. Their blood pressure was going down. and they needed to be cared for in the ICU. And that's really not what we normally see with Kawasaki disease. And we also were seeing a lot of kids who were coming in. Most of these kids were also coming in with abdominal pain or diarrhea or nausea and vomiting. Very few of them had any respiratory symptoms. So that's also a little different than Kawasaki. And when we look at some of the lab values and other things that we use to differentiate the two, there are definitely some differences between Kawasaki disease, toxic shock, and this new syndrome. At least in our cohort, all of the children who had this syndrome had positive antibodies for COVID, which means that they were exposed probably 3 or 4 weeks ago, mounted a response. And in many cases, they had no virus in their nose anymore, but they had the evidence that they had been exposed. And as we know, since it's only been here since maybe February, it could only have been in the past, 2 months.
Wow. So, Dr. Wilson, what does this say about COVID-19 overall? Is this a mutation from a different, or is it a different strain? How would you describe it? And should that concern us?
Yeah, so it's, I think there's so much we don't know, obviously. There is some speculation because we haven't been seeing this multi-system inflammatory syndrome in children or pediatric multi-system inflammatory syndrome. It depends on who you ask, which acronym they're using. We're not really seeing it as much on the West Coast as we are on the East Coast and in Europe, and they didn't really see it in Asia. And there are two strains of the virus. We don't really know much about the differences yet, but you can tell if the virus had come from Asia or the virus had come from Europe. And so there's some speculation that maybe it has to do with the strain that is precipitating this particular post-infectious syndrome. But as I said, we just really don't know. And I think the one thing that we can all agree on is that this coronavirus SARS-CoV-2 is a very, very strange virus. It does things that are unusual in adults and in children.
Is there a different treatment method now that we have this Kawasaki-like syndrome for COVID-19 as opposed to children and adults?
Yes, so we definitely would treat it differently. For the most part, we're treating a lot of the symptoms, but there's some inflammatory markers that are leading us to specific monoclonal antibodies that can be helpful for those particular markers. And so we're kind of converging along a particular treatment course that treats some of the lab values that we're seeing in these kids. And then, for instance, the medication remdesivir, which is an antiviral, if a child doesn't have the virus in their nose, there's really no reason to give that. So if they were positive PCR, we could give them remdesivir, but if they had a negative PCR, then we would not do that. So the treatment is somewhat different. Most kids, at least at Mount Sinai, are getting some kind of anticoagulation.
Okay. So there is a small number of children affected by this, children, teenagers, but every single youngster in our city has experienced a massive lifestyle change because of this pandemic. Dr. Bhatty, how has that affected the mental health of kids that you've seen or read about, and how can adults help to manage some of those new behaviors?
Sure. Well, kids just like us are, having a hard time adjusting. However, kids are resilient and they, can adapt quite easily. So, one of the things to always keep in mind is kids tend to be a bit egocentric. I'm talking more about school-age children. And so, they really kind of look at the world as from their eyes and what impact they've had on the world. So sometimes it's interesting, they're not as worried about the illness per se, they're more worried about how it's affecting them. This, why am I not going to school? Why can I not see my friends? Why am I not having a birthday party this year? And that's not an indication that your child is selfish. It's just developmentally appropriate of how they're viewing this and how it's affecting them. So in those instances, it's just important to kind of explain to them why, things are different and try to do it in a developmentally appropriate way, because they may not understand infection, disease, and how to prevent others from getting ill as well. So that's one of the things to keep in mind. And the other is, as much as we can maintain a routine and a sense of normalcy and consistency for them, that's going to be really helpful. Kids don't do well with uncertainty. They like kind of knowing what to expect next. And so in these, kind of times of uncertainty, it's important that we try to do our best to kind of remain calm and show them that some things are still happening as you would expect. And, your parents are still here. We're still here to protect you, support you. We're doing what we need to do to keep you healthy. And other people outside are doing what they need to do to keep us healthy. So it's really just kind of maintaining the very normal anxiety that they might be experiencing.
Mm-hmm. I mean, there was an article in the New York Times about teenagers who are in love and they can't see their girlfriend or their significant other, and yet you have 4-year-olds who are just questioning every day what's going on. So are there different approaches for the different ages? If you could describe some of those.
Sure, absolutely. I think the first step is, how do you explain this to them? And, a lot of parents have had some difficulty with, how do I explain what's going on to my, preschool child, school age child, and so forth. And I think it's important, once you have an understanding of their understanding of language and if, infection, death, if they've been exposed to death or trauma before, you can use those examples to kind of explain this situation. But it's important that you let them know a little bit about sick and healthy, reinforce ways that we stay healthy, hand washing, etc. And then also, explain just even how bodies fight illnesses. So, sometimes for really young kids, we'll say, your body has internal warriors that fight for you, to help keep you from getting sick. And so we have to do our part to make sure your inside warriors are doing what they need to do. And we have to make sure that we also are protected so that they don't have to work if they don't need to. And, for older children, if they're interested in history, you can, maybe give them some information. I always say from reputable sources, because there's a lot of stuff out there. So the CDC has some really great information for children and teenagers. You can also, maybe make it a historical, like informative thing for them, and look about previous outbreaks and pandemics that we've had, and how they've been, how they've gotten to the other side of it with vaccines and treatments. And so that kind of gives some sense of understanding that, there is some stuff we can refer to that might help show that we can get through this. But yeah, I think for the older children, I think comes down to just also like limiting where they're getting some information from, because it can be really scary out there. There's so many sources, and the news can sensationalize things at times. And, it's really important we validate their feel. I mean, think of all of the high school seniors who didn't get to have a proper graduation or a prom, and, are going through, their first loves and all these normal developmental milestones that they're, having to navigate in a different way. And so it's important that we try to validate, how this is difficult for them and not what's expected. And then also look at the fact that, one day things will go back to normal, and help them kind of look forward to that. And I will say, I think the teens are much more comfortable with the social media, the electronics. They're so connected already. I don't think they've had that much of a difficulty shifting into that kind of communication as some of our adults have.
So Dr. Bhatty, like if you're a parent, you're struggling trying to explain this to your child, the pandemic or this new condition, what do you suggest if you can't afford a therapist, or you don't have, even possibly a pediatrician, which is probably, I would say the vast majority of parents in New York City don't have, access to a doctor readily. What can they do? Are there resources that you can point parents to?
Sure, absolutely. So the American Academy of Child and Adolescent Psychiatrists, ACAP, AACAP, they have a lot of information for families on how to communicate coronavirus information, anxieties around it to children. It breaks it down per age. They also have a lot of links to other sites and resources from articles of ways to do the same, some with like cultural explanations and others. So there's a lot of information out there. I recommend them. And, you know, I think in general, it's just important that parents just know that kids will pick up on whatever anxieties they themselves are having. So if they can help maintain some calmness and be there as a support system for their child, the kids are going to respond to that. Kids know when something's up. And if you're kind of dodging their questions or not giving, or they don't feel like you're being authentic in your response, they're going to look elsewhere for that information, or they're going to, and they may find things that are not going to be helpful in this time. So I think it's important that you have a strategy of how you're going to talk to them that's in line with their developmental age and their ability to understand things. And also be mindful if they've had recent trauma or loss, you know, how they might respond differently too. If they just, you know, had a grandparent pass, or if they just went through a lot of changes in their life, like a parental divorce or something where they've had some changes, they may respond in a different way to so many changes at once. But for the most part, you know, I think as long as you're, you know, honest in an appropriate way and validate their feelings, they're going to be more trusting.
So we'll put those websites in the chat area. Are there any telephone resources that you know of? Let's say a parent needs to call someone to speak to about their
We definitely have some, I know just even within New York, and I'm sure nationally as well. I can send those later. I don't know them off the top of my head, unfortunately.
Thank you.
Thank you. So we've heard of stories where toddlers and other younger children are sliding back in their development, certainly in their socialization skills, because they're not around other kids anymore. Dr. Wilson, could you address that? Achieving milestones that are now somehow elusive because it's not a normal time for these kids.
It is really difficult. And I think that, you know, having a relationship with your pediatrician can be very helpful if you're concerned about milestones not being made, because they may be able to give you some resources or suggestions for where you might be able to augment what you're doing with your very young child to help them reach those milestones. And, you know, I think we are living in New York City in a place where there are tons of other children all around. There's lots of interaction and lots of other kids. And so we're used to that. But there's a lot of communities that are quite rural where you do have children that may not have that much interaction with other children, and they end up doing fine. And it's just a question of figuring out how you can just give them that little push that they need to be able to achieve those milestones. And, you know, now that we have all this technology to use, how can you leverage the technology, you know, and Zoom and being able to have them see other people and engage with other children in a different way than they will be able to, you know, face to face for a little while yet.
What about, you know, regular doctor's appointments, you know, for vaccinations, checkups? What's going on with that?
Yeah, so, you know, what we're really worried about is not this this multi-system inflammatory syndrome in children. What we're really worried about is vaccine preventable diseases coming back, because parents haven't been in because of sheltering in place. They haven't been able to bring their children in. We've been seeing children for their required vaccine visits, but many parents have been scared to come out, scared to ride the subway, which I understand, and, you know, and scared to come to the hospital. And so what we really want to impress on people is that it's really, really critical to get your kids in, particularly for their vaccine visits. We are working to make it safe. What we're doing is we're in all of our practices, and I know many of the outpatient, our voluntary physicians are as well. We are seeing the well visits in the morning, and then we are seeing anybody who is sick who has to come in. We're not seeing them till the late afternoon, and that way we can clean the rooms at the end of the night and have them sit unused until the next morning, just in case. Anybody with any kind of concern for COVID is treated like separately and brought up separately. We're keeping people socially distanced. We're cleaning every room every time a patient goes in or out. We are giving people their own pens so that we don't have to share. So we really, really want to impress on people how important it is to see your pediatrician, to bring your children in when they need vaccines. We're working, we also are doing a lot more video visits. So if we have one of our visits that's a developmental visit, we can actually do very well over the video, because you can watch them and say, okay, have them, I'm going to watch them. Why don't you have them stack those blocks? Why don't you have them draw a circle? And you can have them do it in their own environment. And some kids, when they come into the doctor's office, get very, very nervous. And so you don't really get a good exam. And so in this case, we can do that even in some ways better than we could in the office. So there are lots of options to be in touch with your pediatrician or your child's healthcare provider about that.
I mean, I imagine kids who are more low income and go to neighborhood clinics will be the ones who are most affected in terms of wellness checks.
Yes, and I know. I mean, we have clinics that serve Medicaid, a lot of Medicaid patients, and we are doing the same things with them as we are with our other practices. So we're seeing the same patients through that. And I think that most of the clinics that see patients in New York City have been using similar strategies to make sure that their children are protected so they can come in and get vaccines.
I mean, so the schools were giving out computers because a lot of these kids don't have access to technology. They don't have Wi-Fi, they don't have computers. And so the schools gave them out. Not everyone got one ultimately, but yeah, it's just a fear that they're disadvantaged from the start, and now they're going to slide back even further than kids who have means.
I think that's a real concern. And, I think all of the other things that are more, are sometimes more prevalent in under-resourced communities, things like food insecurity, the tenuous housing that some of these people have. We're actually doing a study now with parents of our children in our practices to look at what the impact of social distancing has been on things like social determinants of health, family stress, food insecurity, missed visits to the doctor, and my own personal interest, if there's been an increase in incursions of either marijuana or tobacco smoke from other apartments while everybody else has been sheltering in place as well.
Yeah, Dr. Wilson, I'm curious to know, since Linda wrote the bill on banning flavored e-cigarettes, and I carried that in the Senate. Is there a correlation yet between e-cigarette use and susceptibility to COVID among young people or adults at this point?
None that I have seen published with e-cigarettes. Part of the problem in doing that is that it's very difficult to disentangle e-cigarette use from tobacco use because there's so much co-use. And then the prevalence of COVID infection in young people has been pretty low. And so I haven't seen any data on that yet, although that still may come out. There was one study out of France that actually thought smoking was helpful, but I've seen several refutals of that. So several scientists in the United States have looked at their data and said that they're really misinterpreting it, and they weren't that it wasn't accurate, and that we probably shouldn't go with the assumption that something in tobacco is actually protective for COVID. And in fact, some of the data coming out of China would indicate that it's actually harmful. And certainly the increased risk in patients with COPD, which is the smoking-related disease, would underscore that.
I mean, the challenge of using data, right, is just that it's just too soon for almost, every cohort and every condition you might analyze, right?
Oh yeah, and right now we're getting so much data and so many studies are coming out, and some of them aren't even peer reviewed like we would normally have. And on the one hand, you want to get as much information out as you can so that we have as much information as we can get when we're making decisions about patients. But on the other hand, you don't want that information to be incorrect. Like the initial studies that showed that hydroxychloroquine was an effective treatment really did not pan out when done on larger studies. And, we wasted probably a lot of medication and potentially could have caused some harm. with that. Now, we didn't have any other choices at that point. We didn't know what we were treating, but I know nationally there's always this, we have to do something, and then we look back and see if it worked.
Well, Sebastian's asking online, does this mystery illness apply to children of all ages? He says he tested positive for the virus and has an 8-year-old child. What should his concerns be?
So I think it's important to remember that this new inflammatory syndrome is very rare. We have had I think 125 cases in New York State, and you think about the number of actual positive cases, positive COVID tests we've had in New York State is far, far larger than that. And we haven't been testing kids because they're not getting sick. For a long time, the only people we were testing were people that were sick, that it might change management. And so I think it's important to remember that this is still very, very, very rare. That being said, whenever you are in a household and you're COVID positive and you have a child there, just being cautious, being a little distant from them, washing your hands, disinfecting the surfaces in the home at least once daily, if not more, and then watching for any signs. So what we would want parents to be looking for would be a fever more than 4 or 5 days, abdominal pain and diarrhea, any kind of rash, and this rash looks like a whole bunch of different, I've seen many different ways that it looks, or red eyes or cracked lips. Those things you would want to call the doctor to find out.
I'm sorry, Sebastian's child is 8 weeks old.
Oh, sorry. I said 8 years. The really little babies don't seem to be getting that sick with this. We have not seen this syndrome, at least in its full form. We had we haven't seen this syndrome in very young children. For the most part, it's been about 2 years, and that's kind of unusual. And it seems like most of the kids have been sort of in the 10 to 13-year-old range. And then we've had a few kids who've been up to as old as 20. Now it's possible that the adult doctors have gotten some 21, 22-year-olds that look similar that we just haven't heard about because they lump them all with COVID. But that's the age range we're seeing. Interestingly, Kawasaki disease tends to be younger. That tends to be in the sort of this 1 year, 6 month to 2 year kind of range.
A lot of older children are missing graduation, prom, other milestone events. And another question is, what about kids who've had their parents get really sick or their grandparents passed away during this time period from COVID? Although other grandparents have passed away because it's when they pass away, but it's all mired in this COVID, scary time for them. So how would you deal with the kids who are missing the graduation and the prom, and then the younger kids, or any age really, who are losing someone dear to them? Dr. Bhatty.
Sure. I mean, well, it's all really bereavement and grief, just of like different things. They're grieving what they thought they were going to have, this normal experience of these life events. And so obviously it's different than the passing of an individual, but if you can approach it with a similar way of understanding that this is difficult for them, this isn't what they expected. This is something that, there is the kind of jointness of, it's not just them, it's really everyone in the country. And it's been really nice to see all these national televised events for everyone by celebrities and others. So there is like a sense of unity in this, and that I think helps. So it's not just them singled out, but it is, a loss, and we should approach it as a loss. As for those who've lost family members or have seen their parents lose their jobs or other kind of really significant changes in their day to day, it's kind of the same approach of how are we going to talk about it and disseminate this information to you? How are we going to, be there to validate your feelings and support you? And then if they're having a, difficulty with, the issue with either some symptoms of a lot of excessive worries, intrusive thoughts, sleep issues, regressions where let's say they won't sleep alone anymore, things like that, at some point you can consider if it's getting to a place where you want to get some just outside assistance to see, is this something that warrants any further help?
For some kids and adults, of course, who lived through 9/11, experienced 9/11, that is the defining moment in their lives thus far. Do you think this too will have such a major impact on people's lives going forward?
Yeah, it's definitely going to be a shared experience. Everyone's going to, refer back to at some point. Do you remember, that time that we all, but I think, it really depends on, everyone, even with 9/11 had a very different, those who were more closely affected by either loss of family members or lived close to the site versus those, we still have young adult patients who, may have lived in the Bronx or New Jersey who are still having, trauma related symptoms, even though they may not have been, individually affected. So I think it comes back to, it is something that is scary and brings on worries about the future. Any kind of outbreak or anything where we don't have a solution right away, which causes fear and worry, is going to cause some trauma-like symptoms. This is a little different than 9/11 in that was like a one-time thing, but of course there was that heightened sense of, uncertainty after it too, and that part is somewhat similar. So yeah, it wouldn't be unusual to see something similar.
And the new normal, we don't know what it'll be. Certainly won't be the same as people have grown up expecting.
Yeah. And I think that's something that, children and adults are going to have. And actually, I think the adults might have a harder time with that than the children, because, kids can adapt much easier than adults in some of these instances.
Dr. Wilson, you talk about vaccines and parents, being reluctant to take their children for well visits, even though they are safe and you encourage them to do so. What happens though if you miss a couple of vaccines, you're off of your schedule? Can you catch up in one visit? How does the timing work in terms of the vaccine schedule and the fact that you may be missing several months because of this concern about attending physicians by going to physicians' offices?
Yeah, there are schedules for catch-up vaccinations, and so there's a way that we can do this pretty, that's been done quite a bit. Obviously, kids miss vaccines for lots of different reasons. Sometimes they're in the hospital, sometimes they don't have health care, sometimes their parents forget, sometimes they don't want to get vaccines and then they're convinced that it's probably a good idea, and so they end up getting them. And so we have ways to catch up. Obviously, it's easier to catch up if, in March, your child missed an 18-month vaccines. They're not due for another set, if I remember correctly, until they're 4. So it's pretty easy to catch them up on the next visit. But if you have a child who's a 2-month-old and missed those 2-month-old vaccinations, those really are critical, because that's when you start getting the protection against things like pertussis that kill children. And so having those 2-month vaccines, and then hopefully the 4 and 6. If you had 2 and then you missed 4, we can catch you up after that. But it's definitely important to get those kids in now to start getting those catch-up vaccines.
Are children showing the same level of antibody response? Are they testing children for antibodies?
So we are only testing children for antibodies if it will, at this point, if it will change the management. So for all of these kids where we're concerned about this COVID, this multi-system inflammatory syndrome in kids or in children, if we're concerned about that, certainly we're testing, and they are showing in immune responses. In fact, very vigorous immune responses. But we really
that's the whole point.
Yeah.
Immune response then.
And that's what's happening in this condition, we think. But I think what we really need to start doing is really offering the wide-scale serologic testing or antibody testing of children. Because if we know how many children are positive for the antibodies, and we know that this very small number of children have had this condition, then we can say what the prevalence in the population is, which helps us really understand the risk a lot better.
Do you think there's anything to be said for like the percentage of children having the antibodies might be higher than adults? I mean, my daughter was tested in a rapid antibody test. Turns out she demonstrated having the antibodies.
She does.
But does it make sense that it would have circulated in the public schools before they closed?
Yeah, I think we're seeing a lot of people who have COVID who just have no idea where they possibly could have gotten it from. And kids, most of them have had very mild symptoms. Like, for example, I have friends who are a couple, and they're my age, so old, but the woman had loss of taste and smell for about 6 days, and that was it. And her husband was really, really sick with it. I mean, it was like, this dichotomy. It's like, we don't understand why some people get so sick and then why some people are totally fine.
So Rabbi is asking, how do asthma and seasonal allergies interact with COVID-19? She read online, which we should take at face value, that you fare better with the virus if you have seasonal allergies. Is that true?
I have not heard that, although that's an interesting concept. But there was a study that came out that looked at asthma and didn't show an increased risk of asthma with of severity of illness with asthma, like we do see with COPD. But certainly it didn't show a protective effect of asthma for adult patients with COVID. And we haven't seen, there's obviously our numbers have been very small, but I haven't seen anything that would suggest either a protective effect or a non-protective effect for allergic disease or asthma with the multi-system inflammatory syndrome.
Maybe Rabia can let us know in the chat room where she saw that. We can let you know.
So hopefully we'll be able to get back out and about. And what I've seen over the weekend from reports, et cetera, is that I guess they're more like kids, people in their 20s are going out to parks and bars and not obeying social distancing at all. Dr. Bhatty, how can children who go out there and see adults misbehaving, what should you tell them if they say, look, all these people are together, why can't I be?
That is a tough one. I think what's important to like educate the kids about is, again,
including the President of the United States.
Right. I was going to say, we're going to have, there's some people who are following some sources of information and others who are following other sources of information. And, it's important for like a younger child, you say, we're doing what we can to stay safe, and we're listening to smart people who are, telling us what we need to do to stay healthy. And if, it's a young child, you might explain to them, I don't think they're following smart people in making some of their decisions. And they can usually get that, because right and wrong is a concept that does kind of solidify earlier on. But as to, particular things, it's just, smart, not smart. We're following the smart. And if they're even more sophisticated, it can be, doctors and science and whatever.
What about the fact that they're with their parents 24/7? I mean, are some growing like too attached so that when it's time to go back out in the world, they might experience some kind of separation anxiety, or, just not be ready to be out in the world? And I know I'm being hopeful by saying that soon we'll be out there, but eventually we will. Dr. Bhatty.
No, that's interesting. I mean, this, happens also with children who maybe were homeschooled for a couple of years and then, are mainstreamed into the educational system. And, this all comes back to kids being resilient. Some kids socialize fine. I know, Dr. Wilson, you mentioned children in rural areas, they're able to pick it up even if they haven't been exposed to it for some time. Now, I think where we get a little bit of difficulty is if they're already anxious and they're anxious about this, and they're getting a lot of reassurance seeking from parents, and they're now very used to being around mom and dad all the time. I mentioned like earlier, keeping routines the same, make sure they sleep separate still. Don't let them like co-sleep with you now because they're scared, because you're going to get into a pattern of things that can lead to long-term anxiety. So it's important that we do what we can to try to help what they should be doing developmentally, and while also just kind of hoping that, like you said, whenever things do go back to normal, they're going to be able to separate and do that appropriately.
Is there a particular age where that kind of separation anxiety is most prevalent? Or is it depending on the circumstance?
Yeah, it depends on the circumstance. But yeah, usually, preschool age is one, school age, and then of course younger with infants, or, when they're younger, but they're not usually separating as much. But it will be interesting. I don't think it's necessarily separation that we're going to be faced with. It's going to be more so fear of going out. Fear of exposing, and this fear that they might have, again, because they're egocentric, that, if something bad happens to my family or me, it's because of something I did, and not necessarily that things were out of their control. They very much feel like, their actions lead to this. And so sometimes they can misattribute bad outcomes. And it's important that we just watch out for that.
Yeah, that's very interesting. Yeah, Brad.
Yeah, well, I'm curious, Dr. Bhatty, like, how does this, generally, this pandemic have an impact on people who might be prone to certain type of obsessive compulsive disorders, like, washing one's hands? Is it going to exacerbate it?
It absolutely can. So it really depends on, there are lots of different types of obsessive compulsive disorders, and we are actually seeing an upswing in those kinds of tendencies. It may not be a disorder yet, but they're definitely going in that way. It really comes down to there's some kind of intrusive or upsetting or distressing thought, and then there's some behavior, whether it's an internal thought or an actual behavior like washing their hands that they're engaging in to like alleviate the thought. And so it's important that we kind of help figure out what is their worry, and then try to work on ways to show that whatever they think they're doing isn't necessarily going to fix that, and there are other ways to do so. The reassurance seeking that I mentioned is something that you're going to see a huge upswing in if you're going to have some OCD-like tendencies. So that's one of the things I'd mentioned. If you notice a lot of that, and there's a lot of worries and there's a lot of reassurance seeking, that may be an indication. Maybe it's better that you get some kind of help now before things maybe spiral more.
It is interesting as the pandemic has, as we've gone up the apex and gone down it. I find myself, slightly more relaxed as somebody living in the city. I'm not wearing gloves, at every turn. I'm, washing my hands and wearing a face mask, but I'm a little more comfortable with myself. Is that generally true, you think, as the numbers decrease and as kind of logic and science show us that we're doing the right thing by the current practices, we'll be healthier emotionally?
Yeah, I think, you're following, again, the smart people and doing, what, everyone is saying this is the next step. And so you're feeling confident about what you are doing. And I think that helps. I think the people that struggle with anxiety, a lot of anxiety is not logic based, and it has to do with thoughts that, and then that's the point of therapy, is to finally get to that point of reframing their cognitive distortions. So it's tougher for them, because even if they are doing everything, they don't necessarily have that logic piece that's there for them to fall back on, that otherwise a person adjusted would.
So Frida asked online, how do you convince Dr. Bhatty or Dr. Wilson, a 3-year-old, to wear a face mask? I have a 2-year-old, so how do you convince a 2-year-old to wear a face mask?
Go ahead.
I'll just say quickly, kids love to mimic their parents, their older siblings, and this could be a really fun way to make them feel like a bigger kid, a grown up. And if they, are really into you know, doing their part to do good. You could even explain that this is how they're keeping other people safe, so they feel like they're, you know, part of this and invested. And so, you know, make it a positive way for them to show that they're a superhero too in doing their part.
Mm-hmm. And I think if they have, it's like anything that you're trying to get a 3-year-old to do that they may not necessarily want to do, like, you know, buckling into their car seat, or you know, washing their hands after they use the bathroom, that sort of thing. So if you can make a game out of it, I think that can be really helpful. And then giving them choices. So if you can get just a, you know, little selection of little cloth masks and prints that they can pick out that they like, and then you can say, do you want to wear, you know, the Barbie mask, or do you want to wear the pony mask? And you give them that choice. And then hopefully, you know, when you can make it seem like it's their decision to wear it, they're more likely to stick with it.
Mm-hmm. What about kids who are struggling with remote learning? How far do you push? At what point do you say, you know what, they'll catch up, it's fine?
So I can speak a little on that. We're having a lot of parents coming in with those kinds of concerns, and I actually work with some educational advocacy groups too about this. So, you know, one of the most important things is, for the most part, it's okay if they're struggling, because, you know, there is altered curricula in place for most regular education students, especially if they have an IEP or they have any special education services. There's even more in place that can be modified during this time, and that can be, you know, even further altered. So, like, you know, I have some patients that they were really struggling with having like daily homework assignments or daily assignments, especially with parents working and being unable to really help them focus at home with a lot of other distractors. And so, you know, we were able to get school to agree to maybe just give the assignments all in one lump sum once a week on a Friday. And so the parent can actually then on the weekend when they're available, help and, you know, get the work done. In some cases, we had reduction in assignments. So there is a bit more flexibility right now. But for the most part, you know, I know there's a big push on, at least in the public system at the DOE, of passing children if they can meet minimum requirements. A lot of regents were waived. So they are understanding, and I think for the most part, they're not really trying to penalize or hold children back during this.
Mm-hmm. Mm-hmm. If a kid gives COVID to an adult, and I don't know if that has happened, does the adult get normal symptoms, or would it be similar to what the kid is experiencing? Or have you not seen that yet, Dr.?
So we certainly believe that children are giving COVID to adults, and an adult would get the adult type of course. If they got sick, they would get the adult type of sickness with typically respiratory symptoms and all of that. We have not seen this post-inflammatory syndrome in adults yet, regardless of the source of where they got it.
You know, people are talking about vaccines, and there are like 100 different groups of doctors and scientists trying to come up with a vaccine. When do you think is a reasonable time to expect there to be a good vaccine for this?
Oh, that's such a hard question.
Yeah.
Probably not December, gotta say. You know, the normal length of time to create a new vaccine is, you know, somewhere between 2 and 10 years, depending on what you're trying to create the vaccine for. Some viruses are more amenable to vaccines than others. Obviously, an HIV vaccine has been in the works for 30 years now. They've been trying to make it, and I think they're still trying to find the right one. With H1N1 flu, I think they were able to come up with a vaccine pretty quickly because we already have a way of creating flu vaccine, and it was just a question of getting a new formulation of it. Every year we put we sort of pick 3 strains to put into that, so it's a little easier to make that happen more quickly. And I'm not really sure where SARS-CoV-2 is going to fit in that mix. I know there's a lot of people that are very hopeful that we can have something in the next, you know, maybe 2 years. But it's you have to test it in people, and you know, I know they're talking about normally when you have a vaccine, you give it to people who are at risk of getting the disease, and then you let them go out into the community and get or not get the disease. And you see if the ones who got the vaccine get less of the disease than the ones who got the placebo. But they're talking even now about trying to find people who are willing to be intentionally infected and to see whether they're less likely to get it if they have the vaccine or not. And that's pretty, like, you're asking somebody to do something that could potentially kill them. And so I'm not really sure that you're going to get a lot of people to do that. But that's why it takes so long, is because you have to wait for people to catch it in the community to see if it works.
So this sounds like we may be having a new normal for 2 years, perhaps, maybe 4. I mean, there is no vaccine for the common cold, right?
Yeah, if it caused more serious disease, then maybe we would. But we might work on that more. But I think, I think we have to be prepared that it could be a while, before we get a really well-designed, effective, proven vaccine.
Just so you know, Dr. Wilson, Rabia says she read about the connection between seasonal allergies and COVID-19 in the Journal of Allergy and Clinical Immunology.
Interesting.
Yes. So breaking news here on our Facebook Live.
I'll have to take a look at that.
Nicole,
I'd be very happy that me and my allergies are.
Yeah, right. Something good to come out of them. Nicole is asking, kids always get sick. How are we as parents going to navigate normal illnesses? Will any child running a fever need to quarantine, even though it's probably just strep or your standard ear infection?
Yeah, so those are great questions. And I think it'll depend a lot on the situation. So first of all, kids with a fever should not go to school should not have gone to school before this all happened. So we would always want to keep children with a fever out of school. Now I think, it's important to, to look at symptoms. If your child has a fever, but it's been, 2 days and they have a runny nose and, a little bit of a cough, then it's probably okay. It's probably something that it could be just a mild COVID, but it's probably not the COVID inflammatory syndrome. But if it's 4 or 5 days and there's abdominal pain and diarrhea and, or some kind of a rash, then I would definitely call their healthcare provider and at least have them do a video visit, if not go in urgent, if you have an urgent visit.
And Tanya's asking, is there a relationship between the inflammatory syndrome that you're seeing in children and the inflammatory response that causes stroke or heart attacks in adults?
So that's a very interesting question. We
experts in our chat room.
Yeah.
It's some of the features. So I'm assuming that she's talking about the heart attacks and strokes that we're seeing in the adults who have COVID. And there are similarities between the sort of the adult cytokine storm that they're seeing in the adult population. This tends to happen as they're starting to get better. So maybe a similar type of presentation, but just these are people that have been sick in the hospital. And so, yes, there's a possibility that there's a relationship, but we really don't understand the pathophysiology yet.
Okay. I think we're about run out of time, but I imagine both of you will be engaged in COVID-related treatments and visits for quite a long time, in addition to your usual array of childhood diseases and issues. So I wish you both the best of luck with that, because it's such a big unknown in terms of physical and mental abilities of the children, of a child's body to fight back, of a child's mind to stay peaceful. And so I really appreciate both of you spending this past hour with us. Thank you.
Thank you.
Thank you. My pleasure.
Thank you so much. It's been really informative. Really appreciate it. Have a good night.
Good night, everyone.
Thank you to our ASL interpreters. John.
Yes.